Good day. My name is Elaiza R Parone from Block A, a BSN 1 student. And today I'm going to perform administering an intradermal injection for skin test. So the purpose of administering intradermal injection for skin test is to provide medication that is required for the client for allergy testing or TB screening. So first thing to do is assessment. First thing is to assess the appearance of the injection site, which is usually 1, 2, 3, 4 fingers below the antecubital area, which is the forearm. And then assess the drug action or the specific drug action or the expected response. And then assess the client's knowledge on the drug response or the drug action, and then check the agency protocol for the sites to be used. Next is we're going to prepare the equipments, which are a pair of clean gloves, a tuberculin syringe. So since I don't have a tuberculin syringe, I'm going to use this 1 cc syringe, and then a vial and an ampule of the correct medication, some cotton balls and alcohol cottons that are filled with alcohol, and then for the waste, and then for the patient, then some alcohol. So first is, and lastly is the MAR, which is the most important thing, the MAR of the patient. Next is to check the MAR and the medication. Compare the label of the medication and the MAR of the patient so that we ensure that the right medication will be given. And then check for the expiration date as well. And then check the overall condition of the medication. Make sure that it is not broken. And then make sure to apply the 3 checks of administering medication, which is 1, when is it taken from the medication cart, 2, before withdrawal of the medication, and then 3, after withdrawal of the medication. And then organize the equipments. Next is we're going to perform hand hygiene. Then, prepare the medication from vial for drug withdrawal. And then dispose your cotton ball. And then prepare your needle. So suppose we're going to withdraw 0.5 millimeters of medication. So we're going to withdraw 5.5 millimeters of air. Next is we're going to prepare the client. Then I'm going to explain what I'm going to do to the client. I'm going to introduce myself, verify the client, and explain the medication. So, good day, sir. I am Elaiza R. Parone, and I will be your student nurse for today. So, first thing is I'm going to verify you. So, can you please tell me your last name? Okay, and then your first name, and then your date of birth. Okay, so today I am going to administer an intradermal injection to test for your allergies or your TB or for TB screening. So you will experience a slight pinching of the needle as it will enter your skin, and then you may experience a small wheal or a small raised area on the area of the injection site, which is totally normal, and this reaction will gradually disappear. So are you ready? Okay, so I am going to provide for client privacy, such as drawing the curtains, for the privacy of the client, and then select and clean the site. So usually the site is 4 fingers below the antecubital. So 1, 2, 3, 4. So this is the area. So I am going to clean it with a cotton ball. And then I'm going to let it dry. And then I'm going to apply clean gloves. And then I'm going to prepare my injection. And then I am going to inject the fluid into the patient, the bevel facing me in 5 to 15 degrees angle. I'm going to use a cotton ball. Then I'm going to discard my needle. And then I'm going to remove my gloves. And I'm going to apply hand hygiene. I'm going to remove the cotton ball. Then I am going to encircle the site. Then I am going to apply hand hygiene again. And then I am going to record my data. Or record relevant information such as the drug medication, the dosage, the time it was administered, and the route it was administered. I am also going to document the nursing assessment that has been done. And then I'm going to evaluate the patient for 24 to 48 hours and to observe for the reaction of the patient for the testing substance. Then I am going to evaluate the reaction of the patient from the testing substance. Usually, we are going to evaluate 24 to 48 hours and then document all the findings.